COVID cases are seeing a slight uptick in India with 257 active cases across the country. This is prompting Indian authorities to monitor COVID surveillance very closely. Also seeing the spike in COVID cases in Bangkok and Singapore. Also taking into account the recent surge of cases in Asian regions, like I mentioned, Hong Kong as well. The latest number of active COVID cases is the highest in the past year, with most of them coming from Kerala, Maharashtra, Tamil Nadu. I also want to go across to our guest now, joining us, Dr. Vivek Nangia, Head of Pulmonology Department, very senior doctor, joining us. Thank you, sir, of Max Healthcare for being with us. My first question, sir, it's many years after 2019, we are yet again seeing this surge in COVID cases. What has led to this? Is this something that India needs to be alarmed about?
So basically, if you remember, even when COVID was around, we used to keep harping that this virus is here to stay. This virus is not something that you'll be able to eliminate out of your ecology. So it is definitely going to be there for times to come, except that it may just keep changing its form, its variant. So even this one that we have is basically a descendant of the Omicron BA.2.86 lineage, and it's called the JN1. It's become globally dominant, primarily due to its high transmissibility and a very potent immune evasion system. It's able to evade the immunity. That basically means that even if you've been exposed to COVID in the past, that doesn't mean that you can't acquire this infection again. So you very well can. There's one particular mutation in one of its spike proteins that enhances its ability to infect the human cells, and which is almost making it 1.5 times more transmissible than the previous viruses. So, this virus is here to stay, and COVID is something that we have to live with probably for the rest of our lives.
What is the best way then, sir, to heal from this COVID?
Sorry?
What is the best way, what precautions should be taken to heal from this COVID?
Basically the same usual precaution that we've always talked about even during COVID. The standard precautions as we call them, or the COVID precautions as we call them by now. Barrier, wearing a mask at all times, staying away from people, avoid overcrowded places, maintain a distance, hand hygiene. So those are the things, keep yourself healthy. Ultimately, it has been seen that it may just be a wild strain causing only a mild infection. But at the same time, it can be very serious and fatal for people who have an underlying comorbidity, like diabetes, hypertension, heart disease, cancer, old age, young children. So especially those need to take full precautions. And also that they should keep their diseases under control. Like if you have your diabetes, the diabetes should be under control with proper medication. But if you have asthma, COPD, you should regularly take your inhalers and keep them under control. So it's very important to keep whatever comorbidity you have under proper controls so that your immune system is better able to handle this kind of a virus.
Dr. Nangia, what would your advice be? What is the best medicine to take to prevent COVID or to take during COVID? And what sort of food should be had during COVID?
So as far as medicine is concerned, there is no medicine that can prevent you from catching COVID except for staying healthy and keeping your immunity up. And as far as food is concerned, I guess best would be to keep yourself well hydrated, keep taking antioxidants. That is the best thing that you can do. And medicine, there is no specific medicine as of now available for this particular strain. We just have to watch the space and see if there are any other new medicines that come up. Of course, we still have our age-old remdesivir, Paxlovid, use of steroids, but those are only reserved for very high-risk cases in only very selected cases and not to be given to anybody and everybody. But I think the best prevention that one can do is that the day anybody acquires any kind of cold cough, which may just be like a simple flu, the best thing to do is to isolate yourself. Don't think that only if you test yourself positive for COVID would you isolate yourself. But even otherwise, even if it is a simple flu, why spread it to the others is my question. So I strongly believe that if I am to develop a cold and cough, I'd rather stay back at home for the next 2, 3, 5 days rather than spread it to the entire world. And then when my own illness becomes serious, then I'll land up in a hospital. So this is something that I think we should all strictly follow, along with the cough etiquettes, which are very, very essential.
Yes. One more question I wanted to ask you, Dr. Nangia. Vaccines. Are there any new dosages of vaccines that need to now be taken with this new surge in COVID cases?
No, not yet. In fact, even the previous vaccines have come into a lot of controversy and a lot of discussion and
Exactly.
debates are happening over that. So as of now, I don't think we have any vaccine that will cover this particular strain.
Do you think any vaccines that we had earlier taken would have helped us, or were they just something that was done? There was no trial. Were we just guinea pigs? What do you think about the vaccines that were actually taken at the time of COVID-19, Dr. Nangia?
No, so that time I think that was an essential move and that did curtail a lot of spread of the infection and did protect a lot of lives. So I wouldn't doubt the utility of those vaccines at all or their efficacy. They may have had some side effects, but I guess that's what the need of the hour was then. You know, whenever you fast track, whenever there's a pandemic kind of a situation, then you have to accept a little bit, a little bit of the side effects of the vaccine also. But yes, they were essential and they have led to a significant impact in reducing the spread of the disease then. But unfortunately, now they may not be as valid because the virus, as expected, has undergone various mutations and there's a new strain, which I'm sure was not covered by the previous vaccine.
Yes. What about the COVID that is also doing the rounds in Hong Kong, Singapore, Bangkok? We are seeing massive number of cases in all these Asian countries, sir.
Yeah, but again, if you see, they're all milder variants only, not resulting in a very huge mortality in any case. So what is important is that if you're traveling especially, then keep your diseases under check, maintain your distance, wear a mask at all times, maintain hand hygiene, cough etiquette. That's very essential. And if you come back from somewhere and fall sick, all the more reason that isolate yourself, stay indoors, and do not spread it to others. That should be a moral responsibility more than anything else.
Do you think there are my last question here, Dr. Nangia, any symptoms that are particular to this new variant?
Nothing in particular really. It's the same as earlier: cough, cold, fever, sore throat, body aches, and some people are even losing their sense of taste and smell.
All right, Dr. Vivek Nangia, one of Delhi's best known pulmonologists, I would say India's. Thank you for joining us, giving us those details, sir. It is something that India is going to be very watchful about, viewers, and we're going to take very good care to ensure COVID does not spread.